Hi, Dr. Pelto here. I'm going to talk today about Achilles tendonitis prevention tips for active women. I see many patients, females, younger and older, that want to be active and they develop plantar fasciitis and Achilles tendonitis, and this really sidelines them from doing all of their activities. So I'm going to talk about what you can do to help with this prevention. The first thing you can do to prevent Achilles tendonitis, and that's pain in the back of the calf, is to prevent the tightness that normally causes it. Many of the patients that we have, they have tightness in the back of the calf that leads to either Achilles tendonitis or plantar fasciitis. And what's the number one thing that you can do to avoid that tightness? I won't even say it's stretching because many patients are stretching wrong. They do the wall stretch. They might do some other type of stretch on a step where they go down and they injure themselves, especially the Achilles. So don't do the one where you go down the step because you can do it too much and actually cause some tearing. What I find most effective is doing foam rolling. So getting a foam roller, roll the back of the calf, and I'm going to also put something underneath here, my treatment process that I give to patients, and it has an actual video explanation of how I treat patients in the office and how I teach them to do the foam rolling if they're dealing or trying to avoid Achilles tendonitis. Number two, to avoid Achilles tendonitis, you want to avoid wearing shoes that are old and worn out. Specifically, if your shoes are too old, for someone that's very active, 3 to 500 miles, that might be about 6 months. If you're an active walker, you want to be aware of the shoes. Another thing to be aware of is if you go from a normal shoe that has a 5 to 7 millimeter drop in the back down to a flat shoe or what we call a zero drop or an anatomic shoe, that many times can cause Achilles tendonitis to develop or tightness in the back of the calf because you're used to having a heeled shoe, then you go down to a very flat shoe. So you have to be careful of the type of shoes that you're wearing. The next thing to prevent it is if you're having pain in the back of the heel, you should get it checked out by someone. If you're having pain where the Achilles inserts into the back of the heel where it hurts, or even slightly above, specifically if there's pain when you squeeze the sides, that's a good indicator you could have Achilles tendonitis. And you might not see the changes or the thickness in the back of the Achilles right away. It can take some time. So if you're feeling that, I think the best thing to do is to be seen by someone. And normally, if you would come to see me, I would do an ultrasound. An ultrasound is actually more beneficial than an x-ray to look at the Achilles tendon because you can see if there's any little micro tears inside of that tendon. Usually micro tears then lead to the thickening of the Achilles tendon. And then the last thing that I'd like you to avoid to prevent Achilles tendonitis is aggressive walking uphill. That can be uphill on a treadmill or uphill on when you're walking outside. Aggressive uphill is going to put more strain in the Achilles tendon. I find many patients that they do a lot of hill work, they can get little micro tears into the Achilles, and that can be harmful. So if you found this beneficial, let me know. Put a little review underneath this video. I'm going to put the actual patient treatment resources that I give to my patients in the office underneath this video. Just click that link and you can learn more about how we treat Achilles tendonitis or trying to prevent Achilles tendonitis in your life.